Cardiologists at Grandview Medical Center use the latest medical technologies in their hospital every day. Now more than ever, senior patients have surgical options that are less invasive. We spoke with interventional cardiologist Dr. Juan Bernal about transcatheter aortic valve replacement, also called TAVR.
Aortic stenosis, which is the disease that is treated with TAVR, is generally a disease of the elderly. So generally elderly patients that have had surgeries before, or they have other comorbidities that will make them a better candidates to have a less invasive approach.
Dr. Bernal showed us what it looks like when the aortic valve is worn out.
As valve disease progresses, calcium starts building up in the valve.
And how this surgery can help this important valve in your heart work again.
Remember, this valve is beating all the time. And eventually it leads to a process that we call like an aortic stenosis, where the valve doesn't open well.
To correct the problem, Dr. Bernal uses this tiny instrument to take the valve replacement into the patient's heart through a large vein.
The valve will be crimping this balloon, okay? It's collapsed before it goes into the body. And then when we have the valve in place where we wanted to deploy it, we inflate a balloon, we inflate this balloon that it's again across the valve, and opens, and then the valve stays in place.
Dr. Bernal performed this exact procedure on his patient Bill Logan a few weeks ago. Already, Logan and his customers at his general store can tell a big difference in his health.
And my color in my face, I had numerous customers say, well, your color has come back now.
With his rosy glow and happy smile, Logan is a young 84. Thanks to Dr. Bernal, he's no longer suffering from shortness of breath and extreme weakness. Now he highly recommends the surgery to anyone who needs it.
I would very much encourage them to look into it. Of course, this is a decision they have to make themselves naturally. But for my part, if I was back, I'd get it as quick as I could.
If you or a loved one suffers from shortness of breath, chest pain, or fainting spells, it may be time to see an interventional cardiologist. The physicians at Grandview Medical Center work together to find the best treatment options for every patient. The heart care team at Grandview Medical Center can also help you live a healthy life, from preventative screenings and lifestyle support to minimally invasive treatments and life-saving emergency care. Visit grandviewheart.com to learn more. In Birmingham, Lillian Lalo, CBS 42 Community.